Joining us live is Jonathan Carapetis. He is the president of the Australian Association of Medical Research Institutes and also the director of the Telethon Kids Institute in Perth. Jonathan, appreciate your time. 10 million additional Pfizer doses, taking our total to 150 million. That's great news, isn't it? If we all had the choice, that's the vaccine we'd be lining up for.
Well, look, yes, it's absolutely, it's great news to see that we are getting those extra 10 million doses of the Pfizer vaccine. We know from the trial results that are out, and indeed some early data that seem to be coming out of places like Israel, that it's a very effective vaccine. We know that it is highly effective at preventing people getting sick from COVID. There's also some optimism, to go to one of the other points that the Prime Minister made, that these very effective vaccines, like the Pfizer vaccine, might also, with time, show some promise in terms of reducing transmission. And that's clearly important if, in the end, we want to get back to some degree of normality. Because right now, the vaccine strategy is largely aimed at stopping people dying or getting very sick from COVID. But in the end, if you want to get your vaccine and hopefully go back to travelling normally, to not having to live with restrictions, then that's only going to happen if we can stop the virus transmitting. And that's the big hope for these vaccines.
Jonathan, you're joining us live from Perth. You're in lockdown this week. What's your assessment of how the COVID situation stands in Perth? We've just heard from the Federal Health Minister, Greg Hunt, there that no extra cases have been recorded in WA today. That's 4 straight days now with no community transmission in Western Australia. It seems so far none of the security guards' contacts have even tested positive. Is it too early to suggest, though, we're out of the woods?
Oh, look, we can't say for sure we're out of the woods, but this is great news. As each day passes, the chance of a late case appearing reduces. We do know, though, that it takes 14 days for us to get out of the incubation period of this virus. So there's always the possibility of cases arising. I guess you'd have to be pretty optimistic with this number of days passing, that, as the Premier has said, that by tomorrow we'd be able to lift the tight lockdown. I think he reasonably pointed out yesterday that we shouldn't expect in Western Australia to go back to what was essentially our normal life before the lockdown straight away, that there will need to be some ongoing restrictions. That makes good sense, because you really want to make sure that there's been no cases for 14 days before you can be pretty confident that we've dealt with this. But it's been great. And I've got to say, Western Australians have been remarkable in after 10 months of no community transmission at all. People have very quickly adapted to the idea of 5 days of hard lockdown, recognising that the experience we've seen in Queensland, the experience we've seen in South Australia, is that this sort of go hard, go early approach really does work, rather than kind of stretch it out for weeks.
We heard a lot of discussion there in that news conference as well about the hotel quarantine setup we have in Australia. We know that the breach in Perth came via hotel quarantine. We've seen similar cases in Brisbane, in Melbourne, just in the last 24 hours as well. There's been a lot of debate about the risks being posed by aerosol spread of the virus. There seems to be more research coming out on that all the time. What's your view? The Prime Minister there saying he thinks broadly our system has been really effective.
Yeah, I think you'd have to say he's right. We have lived in this bubble where, by and large, we've had thousands of people going through hotel quarantine with very few breaches. And I think he's absolutely right when he says we are the envy of the rest of the world. But because of that, if you like, in Australia, we have a very low appetite for things going wrong, and especially when we saw how bad it can get in the Victorian second wave. And so there's kind of 2 ways of looking at this, one of which is, yes, it's been great, but that shouldn't stop us making sure that we're dealing with every possible breach. We need to make sure that we're doing everything we can in the hotel quarantine system to ensure that both the people who are being quarantined and the people who are looking after them and securing them are doing everything they can to make sure that there is not transmission from one of them to another. Yes, we do need to look at this whole issue of the more transmissible strains, and that idea of, could transmission be increasingly through what we call the aerosol route? That's a piece of work that we're still looking at. We do know that the original idea that this virus could only be transmitted by little droplets that are essentially transmitted from one person to another through direct contact or through contact with surfaces, that was probably a little bit oversimplistic, that this virus can exist in small droplets that can float through the air. What we don't understand yet is how far that can go and whether the more transmissible strains increase the risk that that airborne transmission could become a big issue. For now, my understanding is we don't have any belief that there's transmission through things like ventilation systems or air conditioning systems. I think it's much more likely that there might be airborne transmission that is several feet or metres away rather than necessarily a long, long way away, which is what you'd get with air conditioning transmission.
Jonathan, just finally, we've seen a lot of commentary this week about politicians, political leaders like Craig Kelly, for example, casting doubt over the safety of vaccines and pushing other alternative treatments for COVID. I assume that dismays you to see people in these positions of power espousing contrary views to the ones we're hearing from the federal government and our Chief Health Officer. What do you have to say to people who are listening to all of this commentary? They're seeing reports from overseas suggesting, the safety might not be there for certain age groups. What's your message to people who usually would be lining up for things like the flu jab, but when it comes to this COVID vaccine, seem to have some hesitation?
The message is obvious, and that is we as a country, we as a world have done an incredible job when we've listened to the science. And when I say that, listen to the science that comes from reliable sources. The government has been very clear and very good at making sure that the science and the scientists have a very prominent voice. So when we're dealing with people who are spreading misinformation, and unfortunately we're in a world where that misinformation can be spread so easily, every individual who looks at a social media post, that looks at something on the internet, should step back and say, where is that information coming from? Who's sending that information? Is that someone that's reliable? And before anybody then goes and transmits that information to someone else, they need to double check it with a reliable source. And the government websites like the institutes that I head, the medical research institutes, we all make sure that we vet information to ensure that it's scientifically reliable. And so this is not the time to be spreading misinformation about vaccines. Vaccines are going to be a critical part of us controlling this pandemic. I think the other message that we need to learn is that vaccines are not going to be the panacea. We're going to have also our public health measures. We're going to have to continue to develop new vaccines. And frankly, we're going to be living with this virus for many years to come. So we need to find a way to do it. But we need to do it based on science and not misinformation.
Jonathan Carapetis, always enjoy speaking with you. Thanks for your time.
Thanks, Ash.